So you have come to the terms and the realization that your child needs a therapist, and you are trying to figure out where to start. You don't know where to start or what to look for, or you found the therapist, you have a meeting coming up, but you just don't know what the right questions to ask them are. Well, never fear, because I'm here. I am going to give you a list of starter questions that you can ask a therapist. These are important things to know. I am Deidre. I'm a licensed clinical social worker associate, and I work with children and families. And I have been working with children in a classroom setting for a very long time. And so I know a thing or two about children and their families. So before we get into today's video though, don't forget to like, comment, subscribe. Let me know some important questions that you thought of during the video or whatever. Leave them down below. Let me know what things that you feel like I might have missed, or some things that I might not be aware of. Let me know, because I'm interested. All right, let's get into it, y'all. All right, so the first thing, before we get into it though, the first thing that's important is to try to determine the connection, if it would be a good connection between your child and the therapist. So that means you have to know your child, you have to know your child's temperament, you have to know how your child responds to different types of people, because some therapists are like really lively, and then some are very even keel, very, just very calm. And so if you have a child that has anxiety, or a child that gets overwhelmed easily, then you don't need a therapist that cannot adapt to your child's needs, right? So just make sure that you feel confident that your child will feel safe. You'll feel confident that your child will eventually build trust in that therapist, and that the therapist will respect the needs of your child. So you're looking for warmth, patience, and authenticity when you are meeting with that therapist, right? All right, so we got that out of the way. So the first thing, you want to know about the experience that they have with children. Like, have you been working with children for a while? What age group do you typically work with? You want to know, have they treated children who have some of the same concerns that you have, or disorders that your child has? You want to know these things because it lets you know a little bit more about the therapist. It lets you know if this might be a try and see situation, or it might be that this could possibly be the right fit for your child. Ask them, how do they help children feel comfortable in therapy? Ask them, have they worked with children who have similar challenges, which is like what I just explained. Just, hey, have you seen this before? Or what disorders do they typically work with? Or what concerns or challenges in children do they usually work with? Because too, that'll give you their level of comfort. Because it might be that they're really good with anxiety, but they're not that great with children who just have straight autism, or children who have comorbidity, which is more than one disorder existing at one time. So it could be they might have ODD and depression, or they might have just an array of disorders, and the therapist might not have worked with multiple disorders at once, or whatever the case is. So you want to ask that question. What are some disorders or challenges that you've worked with, or that you commonly work with? Next is, we're going to talk about their approach. So the parents should ask, like, what methods the therapist use and why. And sometimes it's never going to be, well, in my experience, there's going to be a multitude of approaches that they have, or methods that they use, because one is not a one fits all type thing, right? People are different, so you have to approach their treatment in different ways, but you want to know that they're well versed in different treatment options. So that's, can you explain your approach to working with children? Do you include play therapy, art therapy, or movement? Because sometimes therapists are just talk there, like they literally just sit across from you and talk, and don't really include other means into the therapy. And that's fine, because that's how they do their work. But for children, a lot of times therapists find that play therapy is very effective. So you just want to know these things. Ask if they're trauma informed, or ask if they're doing, trauma-based cognitive behavioral therapy. You want to ask about family systems. You want to ask about if it's a person-centered approach. Like, you just get more information about what it is what's their background, what's their basis of treatment that they're using. Like for me, like I use cognitive behavioral therapy, but I also use play therapy, and I also I use a bit of like family systems, because children don't exist alone. No one exists alone really, but children especially, they are in a system of people, of other adults and things that impact how they engage and impact their behaviors and all these things. So literally the child is not just the client, it's the whole family when you're working with children. So you want to know. Next, we're going to talk about parent involvement. So you want to ask questions like, how often do we meet as a parent to discuss progress? Or ask them, do they communicate? Is there a way that they prefer to communicate about progress? You can even ask if you're able to be brought in on sessions if need be.
What? What?
For me, I bring in parents. I communicate with parents at least once a month. If I can, I get to them at least once a month. And then certain clients, I will bring in the parent every so often, especially if it's issues concerning the parent-child relationship. Then I'll, bring them together and kind of work through things. But mostly it's emails, just they're catching me up on things that have been happening, or I'm kind of bringing them in the loop, not with confidential information, but hey, this is and I ask my children client, is it okay if I share this with your parents, or whatever they're comfortable with me sharing, then I will talk to the parent. And let me add this in, please parents, if you will. If a therapist asks you to do something for the good of the treatment of your child, please do it.
Don't cry, don't cry, don't cry, don't cry, don't cry. Don't cry.
So if they're asking you, don't talk about certain things around certain people, don't do it. If they're asking you, hey, speak more positively to your child, do it. Because 9 times out of 10, it's because the child has said to them, hey, I feel this way when this happens, or it's really impacting me, and they don't know how to say it to the parent, or if they've said it to the parent and the parent is not listening. So hey, if you get that message from us, please do your part and do what we've asked, because it's only for the good of the child. It does us no good. It's for your child. And let's see, the last thing is almost the last thing is cultural sensitivity and the fit. So is this therapist culturally competent? Are they able to respect your cultural norms that you have as a family and things that you do? Are they able to hear and listen and understand and respect it, even if they don't agree with you? You want a therapist that's going to respect your beliefs and your boundaries about certain things. But that's why I always encourage people to find therapists that fit your cultural needs. So if you are a Christian and you're raising your family to believe in the Bible or believe in whatever it is, see if you can seek out a therapist that also believes in that, because then that'll be it'll be more of a foundation. Now, all Christian beliefs are not the same. Everybody doesn't believe equally in that realm, and so I am aware of that, but at least there's something there's a common ground: prayer, the Bible, those types of things. So if that's what you believe, then find someone that's closely knitted with that. But that's not to say that if you have separate beliefs, you cannot serve, or they can't serve you. That's not true. They can, and they should, if they can do it, if they can do it morally, if they can do it without discriminating or without being disrespectful. And the same goes with same thing with race. It's gonna be a thing of, does that therapist understand the barrier? So for instance, if you're Black and your therapist is white, do you feel like they could understand where your family or your child is coming from when they're talking about barriers and things that are keeping them from doing what it is they need to do, or if things that they've experienced, because children experience discrimination at such a high level and parents don't know, because children don't really, sometimes they don't talk about it. And so will that therapist be able to empathize with them? Not saying that they can't, but will they? These are the questions that you need to be answering and trying to discern when you are trying to find a good therapist. And then the last thing is talk about goals. It's not the last thing, almost the last thing. Talk about goals. How do they set goals for therapy? Ask them, how will they know if your child is growing? Ask them if check-ins, how often will they check in about your child's goals? Because that's a thing. Like, every therapist should be setting goals with their clients to help them move along through treatment. So don't forget goals in progress. And also, so safety and professional standards. So what to do and what are their rules, or what is their process if an emergency is to happen? What is it? What does that look like for them? We all know about confidentiality and only go so far, and that it stops if somebody's at harm or being abused or at risk of being harmed, or if the child is harming themselves. But if an emergency arises, also you want to know, what does that look like? How am I going to be notified? How do you handle emergencies? Because all those things matter too. All right. So, and lastly, ask about insurance. Like, make sure that the therapist takes your insurance, even though a lot of times businesses handle that on the front end before you even get to the therapist. Sometimes they kind of drop the ball. Some places might, not all, some. So just kind of follow up and make sure, hey, you guys take my insurance if you're using insurance. Those are all my tips that I have for this video for if you're looking for a therapist. Don't forget to comment, share, like, subscribe, all those good things, and drop some comments down below. Parents, don't forget to go with your gut, because you know your child best. I forgot to say that. You know your child's needs and temperaments best. So do not forget to trust your gut. And that is all for real. That's all I have. All right, y'all. I'll talk to y'all later. Don't forget to subscribe, and y'all keep checking back. Hit that little bell so you know next time I'm dropping a video, because I'm gonna be dropping videos back to back. So I'll talk to you guys soon. I love you guys. Be healthy, be well, be whole. Bye.